Welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Weaning.
So today we found a very timely topic to discuss, and that is, what is virtual medicine?
Oh, like the goggles. Like put it
Yeah,
on.
sure, right.
Put it on,
Virtual,
you're cured.
that's right. You can play Call of Duty virtually.
VR medicine.
Now, virtual medicine is it's been around for a while, but it's really become popular for obvious reasons over the last little while.
And so the virtual part just means that it's not physically in person. So it can be by telephone or by video conference. I'm sure the people at Zoom and at FaceTime are super happy about the amount of meetings that are done that way. So it's one way for you to connect with your doctor, discuss your problems, potentially identify some solutions, but just not in person to protect you and them.
That's it. That's all it is. It's a patient-physician encounter or patient-healthcare worker encounter that is not in person. Like you said, phone, video, and any platform that you can think of.
Does it work, Paul?
That's a good question. Obviously, we can just give you our perspective from physicians, but we'd love to hear some comments from patients who have had virtual medical encounters. Please give us some comments and let us know if it works for you.
Yeah, positive or negative.
Yeah.
Just honest. Share your story.
I feel like it does. I was doing some virtual medicine before COVID just for patients that lived far away.
Yep.
And I thought it was an important part of my practice, now more so than ever. And I've obviously done a lot more of it since COVID started. And now I'm seeing patients already in follow-up. So I've done a consult and now I'm seeing them in follow-up, and the whole thing has been done virtually. And I have seen some successes. I have seen some happy patients where I did a consult like 3 months ago, recommended a treatment plan, and then saw them in follow-up, and they're like, you know what, I feel better, thank you very much, see you later.
And I think too, thankfully in our specialty, a lot of the diagnosis can come from the history as well as from x-rays and MRIs and things like that, and then the physical exam augments it. There are some specialties that are much more physical exam dependent that just can't be done. You can't listen to someone's heart virtually, but I bet that will come.
And that is the key. That is the element of the virtual consult that's missing. It's the physical examination, because you can't do it. You're not there. And that's the main part that's missing. So, like Dr. Weaning said, you can't do everything. Obviously, we can't do surgery virtually. You can't do everything virtually. There are limitations.
Yep.
And as physicians, we recognize those. If I'm doing a virtual encounter and I hit a point where I'm like, you know what, I can't do any more virtually, you need to see a physician in person. If you live near me, great. We'll try and set up an appointment where I can see you.
Yep.
If not, then we'll try and get you seen locally. Okay, because sometimes you get to a certain point, like that's it, we need to meet each other in person. But much of the time, we can manage things virtually.
And I think at this point our government is still even recommending non-urgent visits to still be done virtually as many times as they can, just to reduce that potential spread of the virus, to keep people safe. But it's very frustrating, just like wait lists are frustrating, but we're all just kind of figuring out I hate new normal, but it's just kind of the new normal.
Silver lining is now often you can see a physician much quicker with the virtual, because it's much easier to schedule than trying to schedule an in-person visit. So that's one of the silver linings.
You don't have to wait in the waiting room?
You don't got to wait in the waiting room.
Pay for parking?
Pay
for gas? Whatever.
You don't have to wear pants. Just wear the shirt where the video's showing, right?
Sure.
There's a lot of pluses here.
A lot of pluses.
Right? And you think once the COVID pandemic is done, or we have a vaccine, do you think that virtual medicine is going to go away?
It will definitely not go away. I think it will reduce, but no, I think it will play a very real, important part in all medicine going forward, for sure.
Yeah, just like
working. Makes sense. Does it working from home?
Just like working from home, just like other industries where they recognize that you can do a lot of stuff not in person. Same thing with medicine. They say the cat is out of the bag. I don't even know where.
Why is the cat in the bag anyway?
Put the cat in the bag.
It's
cruel.
Put the cat out.
It's not nice. If you have a cat in a bag right now, let it out. But the cat is out of the bag. So we think that virtual medicine is going to be here to a certain degree, not as intense as it is now, but to a certain degree, virtual medicine is going to carry on after this pandemic is over. So it is something you might want to explore if you are in need of a medical consultation. And it does work, but please leave us some comments if you've had virtual medicine experiences. Let us know how it's going so we can get better at what we do.
Sure. Essentially, we're providing kind of virtual medicine through these videos. Anyway, we've been doing it for 4 years.
Yeah, it's kind of one-sided.
Trailblazers.
Here we are, pioneers.
Pioneers
really.
of sorts. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own virtual health.
We'll see you next time.